Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast. Today, my name is Terry Fletcher. I hope everyone had a nice Christmas and are heading into the new year. I cannot believe that 2021 is almost over. So in saying that, I know a lot of your physicians took a mini break or on vacation, and I know some of you also did too, and are getting ready to do month end, year end, and get ready for a really, hopefully, productive 2022, especially with all the changes coming up. So what I wanted to add for my 2022 edition on Top 10 Tuesday, since we're at the last Tuesday of the month, is I wanted to add a checklist for clean claims and actually also my quick tips for clean claims, because I think that there's a lot of denials that are happening right now, and a lot of the inefficiencies come from initial reporting. And so when I'm doing a lot of audits or when I'm doing a lot of practice assessments, which has been a big deal that I've been doing a lot lately, I'm noticing that a lot of claim denials are because of the initial reporting on how that was sent. So let's take a look at that from, again, a top 10 look, and we'll see if we can help you out there as you are looking at claims, cleaning up some things, getting ready for year end, and some of you are getting ready to look at reporting for your claims to your physicians and some of your administrators saying, okay, well, here's where we were, but now we have a checklist to make things better in 2022. So let's take a look. So your claims are ready for submission. First, have you made sure that the policy number and ID number are accurate when put into the system? Sometimes these numbers can be transposed, sometimes they can be inaccurate. Obtained insurance eligibility verification. That's a big one. Just because a patient gives you an insurance card, did anybody call or put into the system or check the actual verification of eligibility for the patient, especially for patients who are joining the ACA exchanges? So some of the I'm trying to figure out what the word is, that were reestablished exchanges from the Obama administration that the Biden administration put in. Patients can sign up for that and they have 60 days to pay their premium, but they still get to generate a card. So now they come into your office saying I have coverage and they may not. So make sure that you are checking eligibility and verifying that. Verified other patient information, so their proper name, not a nickname. So you need to match what's on their card. If it's, Robert Fletcher, you want to make sure that they don't put Bob there. Birth date, make sure that you have the correct date, and the year should be the 4 digits, not just 2. The address, and it's the address that is tied to the insurance. So for example, I have a mailing address and then I have a street address, and my insurance card is tied to my mailing address, okay? Because unfortunately, no matter what mailbox I seem to buy at my house, it seems to get my mail wet when it goes in. I just haven't had success there. So I have a mailing address so that it's also protected and secure. Confirm the information the provider gave you for posting the charge entries. A lot of times your provider, your physician, will give you a face sheet from the hospital. Too many times the information from the face sheet is old or dated, or I should say outdated. It's just not good. So I remember years ago when I had a gallbladder surgery, they ran a face sheet for my provider, and I just remember looking over at it, and it had from when I had my daughter. I was at the same hospital, but 15 years before. And so I was just like, and they had the same information. I was even married to somebody different. So that wasn't actually a good idea. So I'm just like, confirm that information. So you have to be careful there. Make sure that obviously the current CPT codes and ICD-10 codes are up to date and specific as possible. Make sure that you have the referral authorization number on the form if applicable. This is going to be really important in 2022, especially now with the AUC and dealing with advanced diagnostics, and that we have to pre-cert a lot of information now for that as well. And then make sure that you include the referring doctor's UPIN or HPI or any kind of number that's on there. That's their unique PIN number, to make sure that you can get paid directly to that person, or they may pay that person instead of paying the employer, that if it's a mid-level provider. So a clean claim is one that has no defect, It has no impropriety or special circumstance. It doesn't have incomplete documentation if it's requested. It doesn't have anything that delays timely payment. And a provider that submits a clean claim by providing the required data elements on the standard claims along with any attachments or any kind of additional elements or revisions that they need, then they have a much better chance of getting paid on the first try. Also, claims for inpatient and facility programs and services, those are on UB 94s and UB 04s, and those are a little bit different as opposed to the CMS, what we used to call HCFA form, 1500 form. So you may have some state guidelines as well. You may be using a contracted clearinghouse, and a lot of the payers don't necessarily like how they submit things electronically, but if we're submitting electronically, we have to make sure it's going to go through the first time through. So if they require attachments, can they take those attachments from the standard form? And many of you know, many payers are putting certain things under 100% audit, and so pre-audit, and so they look at those and want request treatment records for review maybe before or after you file the claim. So we just had 5 tips on making sure that a checklist. Now let's do 5 tips for the clean claim out of your office. So I talked about making sure that you have the right patient ID. Well, what that means is no spaces in the patient ID card. Even though the ID card may have spaces, the electronic claim form cannot in order for it to be a clean claim. So it has to be all together. No symbols in the patient ID, no dashes, no slashes, no asterisks, no special characters. So it has to be exactly like it is on the card, minus the special characters and symbols. Do not add a plan type from the card in the group number field. So for example, if the patient is in an employer insurance and they have different plans, A through F, let's say, and you put in plan F, that can't be listed in the group field because that is for a group number. So it's a numerical group number field only. And if you put in an alpha word or code, then that's going to kick out your claim and it's no longer considered a clean claim. And then the authorization number, so pre-certification numbers, treatment authorization numbers, if that's given to you by the carrier for either the surgery or for the procedure or for the diagnostic, make sure that it is the exact authorization number given by the carrier. Again, no additional characters, words should be listed in order to file that clean claim. And then number 10, do not add notes in the authorization box. I say that all the time. And this is box 19, that's that extra comments box. So for example, don't put no auth required. Always leave this blank if authorization is not required. Otherwise, that could also cause your claim to be denied. So as you're looking at this, as we're at the end of the year, make sure you basically have a meeting and just have another meeting with your billers, with your coders, whoever's entering charges and whoever's submitting claims to the payer, that you're taking a look at some of these tips for filing a clean claim and the checklist for the clean claim. So I would, listen to this over again and just make sure that you have all of your elements, you understand what you need, and that you're going back to basics, because a clean claim is going to get you paid really easily versus having to deal with having to wait for it, and you don't want to do that. My coding question today, I got something that was kind of interesting. I think everybody with the new 2021 rules thinks that all of the CPT codes in the E&M section follow the 2021 E&M rules for office visits, and that's just not the case. So one of my clients had issued, one of my Coding Corner clients said, "Terry, do you have a CMS statement that addresses coding the majority of the visits at the highest level that are based on time?" She said, "And the time, does that have, we're finding that we could possibly do that by time in our skilled nursing facility patients. We just want to make sure we're compliant and we're looking for CMS rules because the providers decided that they want to use time on the CMS rules and as a collaborative effort with our mid-levels." And I'm like, oh boy. So now we have not only a practice that may not understand the rules for SNF, but also that they're kind of taking the rules that we have now for office visits and transferring them to hospital hospital visits. Remember, that's not what you can do. So here's the response to that. And I actually responded to my client before and let them know this would be on air. So SNF visits are different than the 2021 rules for office visits. First of all, remember they're hospital services. So the patient's under a Part A stay, but you're still reporting it to a Part B provider. Time is not a factor in considering a skilled nursing facility visit. So do they have typical times, and I'm air quoting within the language or the documentation or the definition of the code? Yes, but it's all about the multidisciplinary plan of care for a skilled nursing facility resident. So remember that social workers come to the SNF every 21 days because they make sure that they do a full and complete assessment for their eligibility. And this is heavily regulated due to shortages of beds in the skilled nursing facility. So if a patient, I remember when my dad was in one for a short time, if a patient can walk around even with a walker and they feel like they're kind of reached their plateau of their physical therapy or whatever they're in there for, and they can on their own take their medicine, they kick them out. So there is a rule at cms.gov/Medicare. And it is under a coverage database for skilled nursing facilities. Make sure you Google it and look that up. You'll notice that the documentation requirements for SNFs do not include a time element. And SNF services have 3 levels, not 5. The subsequent have 4 levels, not 5. And their typical times listed, but they're also saying those are based on bedside time and floor time contributory to the multidisciplinary plan of care. So it's very regulated. It's very much about the physician's face-to-face with the patient and about why do they need to be in a SNF. So it's about the why, not about the general management of a patient. So make sure that if you're dealing with skilled nursing facility or long-term care facility patients, that you're aware of those rules and those regulations. Okay, our coding question today was brought to you by Gold Bond Ultimate Lotion, skin therapy lotion, healing with aloe, the skin that's nourished, healed, and healthy looking. Again, Gold Bond Ultimate Skin Therapy Lotion. Okay, well, again, I hope everyone has a happy new year, and the next time I talk to you will be in 2022. So thank you for listening, and I'll just give you a tidbit for my personal to this week is that I'm hoping that by the time you hear this, the Steelers are closer and closer to the playoffs. We have to win 3 out of our last 4 to be able to even have a chance. And in one day, we had over 100 NFL players hit a COVID list, and some of them were false positives. So this is interesting to see how that's all going to pan out. But it's all about football for me the last couple of weeks. So we'll see what happens. But everyone, again, have a happy new year and make it a great day. And thank you for listening to the Codecast podcast. Until 2022, have a great week.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.